Hi class, in this recording we are going to focus on the muscles of the lower appendage, the hip, thigh, leg, and foot. So let's get cracking. First we have the iliopsoas. The iliopsoas is a muscle that's really kind of a combo pack muscle. We have the iliacus, and then we are also going to have the psoas major, psoas minor. So within visible body, let's pull it up. To get to these muscles and really highlight them, I'm going to need to remove the external obliques, the rectus abdominis, the transverse abdominis, the internal obliques, and this little band of connective tissue. There we go. So now we can really see these muscle groups. So here we have the iliacus, here's the psoas major, psoas minor, and all three combined, because a lot of times these will just be combined, is going to be referred to as the iliopsoas. Iliopsoas from your lab objective sheet. The next muscle is the Sartorius. I like to think of this as the seatbelt or leg crossing muscle. Traditionally, it's been referred to as the tailor muscle or seamstress muscle, the sewer's muscle. So as we look at this muscle, it goes across the anterior of the thigh, all the way from the lateral margin of the hip to the medial margin of the knee. So this muscle, when it's contracted, will allow you to cross your leg. It's the leg crossing muscle. Next we have the Gracilis. As we are looking at these muscles, let's hide that Sartorius. And really emphasize the Gracilis here. I'm going to go ahead and see if I can just remove, let's use the breadcrumbs here, the left lower limb. I'm going to hide the entirety of the left lower limb and right there, all the bones of the left lower limb. So now we're just going to focus on the right leg here, just to make life a little bit easier for us. So while we're looking for the Gracilis, that Gracilis is going to be the most medial muscle of the thigh. It is going to when contracted, it's going to cause adduction. A-D as in dog, duction. Next we have our Pectineus, which is really grouped with the Adductor Longus and Adductor Magnus. They're all right next to each other. So as we're looking at the Pectineus is going to be more laterally originates more laterally on the pubic bone, whereas the Adductor Longus originates more medially on the pubic bone. So here we have the Pectineus. I'll go ahead and get rid of the Sartorius so we can have a better view of the Pectineus. So it's superior and lateral relative to the Adductor Longus. And while we're looking at the Adductor Longus, we also have the Adductor Magnus right here. And I should go ahead and restore some muscles in a moment, and I will do that. The Adductor Longus and Adductor Magnus, from a superficial view, can be kind of deceiving. The Adductor Magnus just doesn't look that big. So I'm going to go ahead and clean up this view and remove some of the muscles that obscure our view, notably the Gracilis. So I'll remove the Gracilis right there and highlight the Adductor Magnus so you can see just how massive that muscle really is. And the Adductor Longus is much smaller. Those of you who are starting to catch on to the naming systems are probably wondering, hey, if there's a longus right here, what about the shortest or the brevis? And there is one. We'll remove the Pectineus, and you can see the Adductor brevis right here. So we have Adductor Longus and Adductor Magnus. We do not have the Adductor brevis on your lab objective sheet because with the models that we have for the in-person lab, we can't actually find that muscle. So this list is a list of muscles that we can find on the in-person models, and that's also within your lab manual. Next we have the rectus femoris, vastus lateralis, vastus medialis. These are three muscles of the quadriceps. So as we're looking for the quads, the vastus medialis is going to be on the medial margin of the thigh. The vastus lateralis is on the lateral margin of the thigh, and the rectus femoris is on the anterior of the thigh. And those of you are probably thinking quadriceps. What's the fourth muscle? The fourth muscle is not on your lab objective sheet, but it's going to be deep to the rectus femoris. It's the vastus intermedialis. So we have vastus medialis, vastus lateralis, and then there's the rectus femoris on your lab objective sheet. I've been removing too many muscles here, so let's muscle up here. I just added all of our muscles. Let's remove the left lower limb and continue. So now we have the tensor fasciae lata. Tensor fasciae lata is going to be the most lateral muscle. Right there, we have our tensor fasciae lata, or I like to say latae. And the tensor fasciae lata will go down to this sheet of connective tissue on the lateral margin of the thigh, oftentimes referred to as the IT band in athletic circles, or the iliotibial band. It goes all the way from the ilium, way up here, all the way down to the tibia, down there, hence the name iliotibial band. That's not on your list, but I get excited about these things, so I'm throwing in a few bonuses. As we're looking at the gluteus maximus and gluteus medius, most students will know this one, gluteus maximus, off the top of your heads. The gluteus maximus is the big butt muscle, as opposed to the little butt muscle. So, right here is our gluteus maximus. And if I hide the gluteus maximus, you can see the gluteus medius is deep and superior to gluteus maximus. So to show you up here, you can see the gluteus medius from a superficial view. It's not 100% obscured by the gluteus maximus. And if I remove that gluteus maximus, it's easier to see the gluteus medius. No, we do not ask you to know the gluteus minimus. If there's a medius here, there's got to be a minimus. We're not going to ask you for that one. And now we're going to have your hamstring muscles, the hammies. So we have the biceps femoris, semitendinosus, semimembranosus. So as we're looking at the posterior of the thigh, the biceps femoris is going to be on the posterior and lateral margins of the thigh, and then the semitendinosus, semimembranosus are on the medial margins. Here's the semitendinosus. I like to think of the semitendinosus as being on top or superficial to the semimembranosus. So T for tendinosus, T for top. And then we're going to have the semimembranosus. The semimembranosus is deep to the semitendinosus and is also going to be more massive in size. So as we look at these three, we have the biceps femoris, the semitendinosus, and the semimembranosus, making up the hamstrings, the three muscles of the hamstrings. And that's it for the hip and thigh. Let's move on to the leg and foot. We'll start off with the gastrocnemius and soleus on the posterior of the lower leg, or the posterior of the calf. So here we have the gastrocnemius. Gastrocnemius refers to the fact that this has a large belly, or the belly of these muscles, or main body of these muscles, kind of resemble the human stomach to early anatomists. So here we have the gastrocnemius, and there's one on the left leg, one on the right leg, with a medial and lateral head. And then deep to the gastrocnemius, we have the soleus. And the soleus is also visible from a superficial view. I'll go ahead and hide this tendon to expose the soleus of the lower leg. And as we look at this muscle of the lower leg, I want to emphasize that the soleus is also going to be deep to what is commonly referred to as the Achilles tendon as well. So we have the gastrocnemius and soleus, and next we have the flexor digitorum longus. The name says it all right here. This is a flexor, which means it's going to be on the anterior. It's going to connect to the digits or the toes, and it's a long muscle. Another muscle that's going to be on the anterior of the lower leg is the tibialis anterior. This one is going to be directly anterior to the tibia. So let's flip this around and check out our lower leg. So here is the tibia as our frame of reference. On the most anterior portion of the tibia, we have the tibialis anterior, and then right next to the tibialis anterior, right here, going down to all the little toes. Notice how we have those insertions down at the tip of the four toes, toes 2 through 5. We have the extensor digitorum longus highlighted right here. And then finally, we have the fibularis. I want you to use the term fibularis as opposed to fibularis longus and fibularis brevis, even though visible body separates them. So here's the fibula bone as a frame of reference. The fibularis is going to be right over the fibula bone. So an old school name is the peroneus muscle, because this used to be referred to as the peroneal region as opposed to the fibular region. I'm a big fan of fibular personally. So we have the fibularis longus and the fibularis brevis right down there. So combining these two, these two muscles combined are considered the fibularis muscle. So the fibularis is broken down into a longus group and a brevis group. But collectively, just think lateral margin of the lower leg and right over the fibula for the fibularis. And that's it for the muscles of the lower appendage. If you have any questions or comments, please feel free to post them in the class discussions or shoot me an email. And as always, happy studies.